Welcome. This is the Climate and Health Report for March 2022. I am Dr. IMARA JOYCE NCHOM. Contained in this report is the monthly disease vigilance for Nigeria, valid for 1st to 31st of March. Before proceeding, understanding the climate of Nigeria is important. So, what is the climate of Nigeria in March? The month of March is also categorized as one of the dry season months in Nigeria, particularly over the northern parts of the country, where the north is largely characterized by the dry northeasterly winds from the Sahara, while over the south, southwesterlies are circumscribed around the coast and inland areas of the country and occasionally reaching the central region. During this period, nights are usually warm and daytime temperatures high. Conversely, dusty atmosphere prevails in the northern fringes of the country. Now, weather plays a significant role in the emergence and spread of diseases. This report seeks to present disease vigilance of some climate-sensitive diseases. Some of the diseases and allergies associated with the weather condition in March are meningitis, dehydration, cold, chapped skin and lips, measles, among others. For the general outlook for March, like February, the predicted climatic conditions for March 2022 indicate about 60% prospect of normal conditions of dryness over the north and central states, 55% probability of above normal rainfall over the coastal and some inland southern states, with 25% possibilities of below normal rainfall as depicted in green in the legend. Other global models like the probabilistic multimodal ensemble by the World Meteorological Organization's lead forecasts for long-range forecast multimodal ensemble are in consonance with the prediction for most parts of the country. The intertropical discontinuity, ITD. The average latitudinal position of the ITD for March is projected to be at approximately 10 degrees north of the equator. By implication, the north and few areas in the central states would largely be influenced by cold, dry northeasterly winds, while the southern region to southern and parts of the central cities would be relatively under warm and moist southwesterly winds. Disease vigilance. Meningitis. The forecast for the month of March indicates that conditions like relative humidity, mean air temperature, and dust are favorable for the emergence of meningitis over northern parts of the country. Meningitis vigilance. The northern parts of the country are likely to keep watch for high cases of meningitis. Kaduna, Plateau, Niger, parts of Abuja, Adamawa, and Taraba states are projected to have moderate watch for meningitis. Low vigilance for the disease is expected over Kwara, Kogi, Benue, and Ekiti states. The coastal and parts of the southern region are expected to also keep low watch for the disease. Meningitis implication. Meningitis causes inflammation of the brain, which in turn causes other problems like seizures, memory distress and loss of concentration even after illness has passed. This is so because swelling around the brain interferes with the senses. Most times it leaves children with learning disabilities afterwards and even deafness. To abate its effect, according to the Nigeria Center for Disease Control (NCDC) guidelines on meningitis, cover your nose and mouth with disposable tissue or by blowing into elbow when sneezing or coughing. Ensure you wash your hands frequently, especially after coughing or sneezing. Avoid overcrowding and ensure adequate ventilation at home Also, remember to visit a health facility if you have sudden high fever or neck stiffness for proper diagnosis and treatment. Health personnel are advised to always practice universal care precaution. Thank you for watching. For enquiries, you can visit our website on www.nimed.gov.ng or send us an email on info@nimed.gov.ng. You can interact with us on our social media platforms as displayed on the screen, on Facebook and Twitter, and on Instagram @official NIMED NG. Thank you for watching.